welcome to all our participants today. So yesterday there was a discussion about community projects, a query about community projects. So I just wanted to give a small example. So when we start something, we need to know what are the costs and the benefits. So if you look at this, this is a project that has recently been started at Makunda. So that is Makunda. So a hospital-run community project with maybe about 5 members probably can travel about 20 kilometers in our terrain, 20 kilometers to a village to spend the day there and then return back before it is too late. So to run such a project, at the moment we have started a project like that, which is actually a research project. The cost runs to a few crore rupees. And if you see in this, I'm not able to annotate it, but if you see in this map, the red dot is Makunda, and there is a green area above and below. So that is our area controlled by this project. So this is a larger map of the same area. And if you see, our hospital's drainage area is a radius of nearly 200 kilometers. So the expenditure is now spread out over a very large area. And if you look at our paediatric surgical work, that is covering the southern half of Northeast India. And recently we even had a patient from our sister hospital in Raxaul, which is in the Nepal border. So everything depends upon how much the need is and how much resources are available, whether we can have a Christian private practice. So I feel that it is limited in its scope, except that if we maybe a single doctor or maybe a husband and wife start a hospital, they may not be able to expand very much unless they are either a society or a trust or a company, because there are a lot of benefits that a charitable entity can receive which are not given to a privately owned practice. And one of the dangers is that it is run by one family and it is difficult to ensure the preservation of the vision for the future. And since there is no management and governance structure, values can be compromised. Marriage. I think it's a very important decision that can make or break a career in missions. There are many people who have had to leave missions because that partner was not happy with that. So one of the problems is getting into emotional relationships while in college. So people have done a functional MRI of the brain and found that this emotional relationship has a pattern similar to drug addiction. So very often people lose their missionary vision. Sometimes people may be called to remain single. A lot of the medical missionary work in India was done by single women. And the reason was that they could not find suitable boys to marry. And that may be God's portion for some, and it's neither a weakness nor a disgrace. I have written about this in a blog, which I have shown here, and I will put the links in the chat box. So today's talk is about leadership. Good leaders, or you can say influencers, people who influence other people, because everybody cannot be leaders. Good leaders can make or break an institution. So for a successful, godly medical missionary work, we need leaders who enjoy a close walk with God, and they understand God's plans and purposes for that institution. It's not their plans and purposes, but God's plans and purposes. They must see themselves as instruments in God's hands. Only then God's power will flow through them. And I think leaders means everybody, including parents, including sisters and brothers, including colleagues in departments. So we are all influencing each other. And we must learn to trust God and to obey Him without question. And it is very important that we must acknowledge that. So whenever somebody says, Makunda is doing very well, I always say, by the grace of God and by the hard work of many highly committed co-workers. So we should never say that it was all because of me. And that is a danger that we face. So I just wanted to give this picture. I saw this in another webinar which I had attended recently. So what sort of leaders are we? Are we a title leader? And a title is like a crown on somebody's head. Or are we like the towel? So this fits in with the plenary session we just heard from Dr. Arul Ankatal. The picture on the right is actually the logo of our hospital, in which there is a towel wrapped over the cross. It signifies Christian service, but it also signifies servant leadership, or leadership that is marked by service. So title type of leaders, they want to be known by their title. So director, they want to be known as director or head of the department. And sometimes people may even behave as if they are the emperor, somebody with absolute control. So they are very interested in their power, their ability to give orders. I hereby direct, I hereby instruct. They are very ambitious, and they want to have the title displayed everywhere. There are people who even put a small box on their cars saying medical superintendent of this hospital. And they want others to please them so that they may earn their respect. So they may say, I don't like him very much. I don't respect him because I don't like him. They want to be surrounded by yes-sayers. So they have a small coterie of people around them who keep on saying, yes, yes, you're doing very well. And this is all because of their insecurity. They are not secure in their position as God's children. And the main big problem with these leaders is that they create a generation of similar leaders after them. So the people who follow want to copy what they were doing. But if you compare that to towel leaders, the primary motive of a towel leader is the task that has been assigned to them. And then secondly, they want their priority is the people who work for them. Maybe sometimes they can just do the job themselves. But now that they are in charge of many other people, they want to empower them and stand by them and hold them in their hand and make the work to be done through others. They are secure in their standing with God and in their standing in the workplace. They want to help other people and earn the respect of the others, which is the exact opposite of a title leader. And they create a generation of towel leaders by setting a positive example. They are relatively thick-skinned and easy for others to be blunt and frank with, which is an extremely important character that a leader should have. So if I keep getting angry, if I say I am irritated, or if I burst into tears, then nobody would want to say anything because they are afraid what would happen. But if people can criticize me and say anything they want, then they are quite frank and blunt with me. And tower leaders also choose good mentors who are not afraid to criticize them. So I just wanted to show you this photograph. I don't know how many of you know this. This is a photograph taken in the year 1990 by Voyager 1, and it is actually showing the ring of one of the rings of Saturn. So that vertical bar is a ring of Saturn, and the small dot over there is Earth. So this photograph just shows how insignificant we are. So this is called the God view. It's actually not the God view because there are many more galaxies and universes and all that. But in that small blue dot are the 7 billion people in this world today, and we are just one of them. So we should remember that in God's sight, we are really a small, very small piece of the big plan that He has. And all leaders make mistakes. So we all have a learning curve. So I was just thinking of a surgeon. So when a surgeon is got his MS in general surgery or whatever, and he has assumed his job, then sometimes people start to think, I have a license to cut, or maybe you can say a license to kill. So they start doing rash things. So that is one part. And then after they start doing well, so somebody starts doing laparoscopic cholecystectomies. After doing 100 of them, he starts to think, now I am an expert, and become overconfident. And the next one, he cuts through the bile ducts. So these are things that happen to all of us. And we must know that at certain stages of our career as leaders, we are bound to make mistakes. The wheel need not be reinvented. So somebody has already done a very good job and has made a good protocol which is working well. So we need not go through the whole thing again just to save time and energy. A good leader learns from everyone. So yesterday I was telling about how a junior doctor taught me something. One day while I was doing a laparoscopic cholecystectomy, several small stones fell into the peritoneal cavity. And I was just thinking how to take them out one by one. And the nurse who was assisting me said, sir, why don't you just cut off the tip of the sterile pack in which we keep the Foley's catheter, and you can use that as a retrieval bag. And that really worked well. And since then I have been using that. So senior leaders should start teaching as soon as a suitable person is available. So I have been working for 5 years, and now a young, very capable person has come. So I should start teaching him all the things I know, because he may soon be a second line leader. And I should not say, no, you should not do any more of these procedures. I am the only one who will do it. So unfortunately, many people in our mission field are like that. And junior leaders should keep in touch with their seniors. So 20 years after I completed my specialization in pediatric surgery, I still contact my professor and head of department at Vellore and tell him, sir, I have just operated on a baby. I do not know what to do about this problem. And they have much greater years of experience, and there will always be something to learn. Or if there is nothing new, a word of encouragement to say, don't worry, I have been where you are. And all of us learn. Some of us learn by avoiding mistakes. They are very careful. They know that something can go wrong. They keep on asking for advice, and they learn their lessons without making major mistakes, like without killing a patient or without causing a lot of distress or loss to an institution. But there are other leaders who learn by making mistakes. So they make a mistake and then they know, oh, I should not do that again. But then it may be at the cost of someone or the cost of an institution. So it is better to be a careful leader than a hasty one, so that we don't cause unnecessary loss. So this is the structure of missions. It's actually the structure of all societies, trusts, and companies. We have a management committee. So in a hospital, it could be the medical superintendent, the nursing superintendent, maybe if there is a school also, then the principal of that school, and so on. So these are the people who make plans for the future. Plan for next year, plan for next month, plan for the next 10 years. And then they are involved in the day-to-day management, making purchases, recruiting people, taking disciplinary action, and so on. Then they also assume risks. So sometimes you have to do something which is very risky. Maybe you can get into a violent situation, but it is worth the risk. And that is what I meant by risk versus benefit. Sometimes the benefit is so much that it is worth taking that risk. And they need to own the entire project. They prepare reports and get approvals, and they get audited. They are responsible for recruitment and retention, and they are the ones who engage with the target population. And in our case, that is our patients. And above the management, there is a governance system. So they are a board of governors. They are not people who work in the hospital. They may be people who work in other hospitals, maybe people who are in the church, maybe experts in other areas, maybe legal experts, financial experts. So their job is to provide oversight and support. So when we present a plan to the board of governors, they will say, is this available? Is this activity permitted by the objects of your association? So you want to start a school. Do you have the means to do that? Do you have the money? Do you have the buildings? Do you have the people? Do you have the permission? And do your documents allow you to start a school? So it is like somebody counter-checking whether you have everything right. And what are the rules of the country? Maybe the rules in Pakistan are different. The rules in Nepal are different. So are you able to meet those rules? So you have submitted the audited statement of the previous year. So the auditor has made 10 comments. So please give a point-by-point answer to each of those comments and action taken report, so that those comments will not be made again next year. So you have made a budget for next year, but your income is not adequate to meet the budget. So it looks more like a wish list than a budget. Could you please remove unnecessary expenses or increase sources of income so that your budget is balanced? So this is the job of the governors. And they create policies, anti-fraud policy, policy for prevention of sexual harassment. So all these policies are made by the governors. And they are also responsible for introduction to external supporters or to the government or to internal donors. And they assist with recruitment. And they are also responsible for grievance redressal. So suppose somebody has a complaint against the director of an institution. So he's the top person in the institution. So they must have a higher body to complain to. And that body is the board of governors. So these are all the advantages in belonging to like a formal structure, like a society or a trust or a company. So sometimes many of the problems in our mission hospitals come because there is an imbalance of power. So sometimes the management is going off in a wrong direction. They are maybe selling away the hospital's properties for personal benefits. And sometimes the board is too strong and they don't allow the management to take a good rational decision. So this is some suggestion that I have. So when a hospital is doing well, the board should adopt a hands-off approach. They must just commend the management and say you're doing really well. We appreciate all the work you're doing. But when the hospital is sick, they must get involved. And that is a hands-on approach. Maybe they must start interfering and putting in steps so that the hospital will come back to good health. Giving autonomous functioning to the management allows ownership, and it's not only to the hospital. Suppose we have a department, giving some good level of autonomous power to the head of the department gives that person ownership, and that fuels innovation. People make brilliant ideas because they have been given the power to do so. And in the opposite thing is, if you micromanage and control every small thing, then that is destructive. People lose ownership and they stop being innovative. And maybe they may even leave the institution because they think that they don't have any freedom anymore. So many best practices have been developed, and we need not reinvent all the ways to adopt, the best practices to adopt. This is one which I recommend. In our hospital, all the people involved in administration are expected to complete this course. It is free of cost, and I will put it up in the chat box. So we should adopt the best practices. Just because we are a Christian institution doesn't mean that we can do whatever we like. So yesterday I was telling you about recruitment. Come follow me, I will make you fishers of men. So some years ago, our hospital decided that we would start a branch hospital in the state of Tripura. Tripura was full of militants. Only big problem is we did not have anybody to go and work there. We had just enough staff for our own hospital. So I went and visited the Regional Institute of Medical Sciences at Imphal in Manipur, and they have a mission interest group. So I told them, see, we want to start a hospital for the state of Tripura. So we are going to put the money for it. I just need 2 of you to volunteer. So you would be thinking, who would go and volunteer such a place? But to our surprise, 2 months later, 2 doctors came and joined us saying that we want to work in that new hospital. Similarly, I went to Aizawl and spoke to nursing students, BSc first year nursing students, and I told, we want to start a college of nursing and we need BSc tutors. And 4 years later, I got a message saying that 3 of them had inquired whether that project is still on because they remembered the invitation. So that is what we need to present when we go and talk to college students and in conferences, to give a dream for them to fulfill, something that is larger than themselves. But there is also quality control. So Jesus told this rich young ruler, one thing you lack, go and sell all you possess and give it to the poor, and then come and follow me. Sometimes people come to our hospitals and they are not willing to work hard. They are expecting too much, more salary, more benefits. And we need to say, I am very sorry, but if you need to join this place, these are the minimum requirements. Otherwise, you do not meet our quality standards. And in Makunda, we have let many people go. It is better to have few staff who are highly committed to the cause than many people who will spoil our basket. So that is my wife, and that is my elder daughter on her back, and that baby had a tracheoesophageal fistula, which I have just operated. So this baby cannot breathe and needs to be ventilated for 4 days, but we do not have a ventilator. So that is my wife ventilating this baby for 4 days by hand. So when a senior staff is doing that, do you think the junior staff will be less committed? So I feel that is where we need to set personal examples. We should be willing to do everything that we expect out of our junior staff, and then they will gladly follow. We need to visit the homes of our staff. So whenever we find somebody with some passion, somebody who has difficulties in convincing their parents to stay on, then my wife and me would travel to their home. So we have traveled to all the states of Northeast India, many homes in South India, just to talk to their parents, just to say, your son, your daughter is doing a wonderful job. Would you not let her stay on with us for some more time? Sometimes they will say, but there is no security in a mission field. And we will say, no, you are mistaken. These are all the facilities that we provide. And sometimes after we have spoken to them, they will allow the child to stay on for a longer period of time. How many of us invite our staff home? So we hear stories of Jesus eating with people. He entered into the homes of people. And the wonderful thing is that every meal was a point of engagement. So I'm not talking about having a barbecue party or something like that. It is to call someone home, ask about their parents, ask about their workplace. Are you happy here? What is your difficulty? Is there something I can do for you? So just inquiring about people, that creates a family. So we always say we are one large family, but unless we can do this, we are really not a family. And when there is family, there is a longing for each other. So when I tell someone, please do this work, they are not doing because I am their boss. They are doing because I am like their father or like their brother, and we are a family. So in this is the shortest verse in the Bible. Jesus wept. He brought Lazarus back to life, but he joined with Martha and Mary in the time of loss. So whenever our staff go through difficulties, when somebody died in their home, when somebody is diagnosed with cancer, when one of the children is going astray, are they not wonderful opportunities for us to enter into their lives and be with them in their moment of despair? So my wife would always say, I have just come home. It's already 8 o'clock, but I must go to this home. I must be with them just for a few minutes, just to cry with them and share in their loss. So when somebody has come to our hospital and we are looking at them, not just a doctor, any other staff, we should say, if I were to do a small SWOT analysis on this person, what are his or her strengths and weaknesses and opportunities and threats? Should I visit their home? Sometimes people have difficulties with their marriage. Parents are not agreeing, but they are a good couple. At Makunda, we have organized several marriages, and twice I have been the father of the bride because the actual father was not willing. We need to help with career plans. Sometimes people do not have money to do the course which they really need to do, which is the correct one for them. I think in the last few years, we have spent about 35 lakh rupees, which is about, I think, 40,000 US dollars on advancing money for people's career, and they come back and repay that. We need to delegate responsibilities so that everybody feels I am part of this big job. This is my hospital, my department. We need to build up other leaders and listen to everyone. Somebody might have a brilliant idea which you have not thought of. And many times we lose people who go on to other mission hospitals, and that is not attrition. They are our ambassadors, taking a small seed from us, from Makunda to another place. So let us stop for a moment and think about our staff. Who amongst our present staff has leadership potential? Who is saying that I will stay for 10 years or 5 years? Who is owning this vision? Who is talking proudly about the wonderful work that is going on in our place? So these are the people we send to recruit. So they go and speak to their juniors in college, to their family members, to their contacts, and then they say, I have been having a wonderful time in this place. Would you not come and join? And they will be convincing because they speak with personal experience and the passion. Who are the people among our present staff who have a passion for the target people? So in Makunda, target people are the poor. So who are the people who spend time with these poor people who have come far long distances to be with us, who are empathetic to them? Who are the people in our team who are willing to delay gratification, delay going for their post-graduation, delay or denying themselves leave for which they are eligible? And who are the people who are willing to talk and to listen? So these are the people who are developing, who have that leadership potential. I think a large number of you are college students. So when I was in college and I started to see where God was leading me, I realized that I was short of many qualities. I was not a person who had leadership potential. So I went about correcting each one of them. So I assumed leadership positions in college. I became the under officer of the Cadet Corps, the National Cadet Corps, the General Secretary of the National Social Service Scheme, the class representative for 2 years. And through all that, I learned to interact with people, to talk to people, to make decisions, make mistakes, and develop leadership qualities. So if you are in college and you have a few more years to go, examine yourself and see, where am I lacking? Is it in my social abilities? Is it in my decision-making abilities? Is it in integrity issues? And ask God for help to overcome those problems. So we need to develop a second line and a third line and maybe a fourth line, because we need a contingency plan. We do not know what will happen to people. So succession is very important. All of us will be replaced one day. So sometimes in mission hospitals, there are people who think that they are like emperor for life, or I will not step down. If the retirement age is 60, and when they come to 60, they will pass an amendment to make it 62, so they can stay for 2 more years. But a good leader will start planning for succession as soon as possible. So in our strategic plan, we said that by year 25, we must identify one person, then spend 2 years in training that person for the job, then make that person the leader, and then stay on for 3 more years to handhold that person. So that was our succession plan, and God brought a person like that to Makunda. And God is faithful, and He will help us if we do our work. So stop and think, is there someone who can do a part of my work today? To someone to whom I can give a little additional responsibility, and I can stand by and train and handhold that person. And they need to be groomed and trained constantly. So it is like driving a bus. So you're driving a bus, and your second line leader is in the first seat next to you. So after a few years, you say, now you drive the bus, and I will sit next to you. And then you can say, see, now you have to be a little careful. The road is sloping up. So this is what you need to do. So I think all this is very important for our mission hospitals not to become sick. And then there is mission drift. So very often the first generation of people are pioneering, self-sacrificing, and very idealistic. The second generation of people have lived with the first generation, and therefore they have some rubbed off values. But now they start thinking more about institutional changes. So instead of being poor friendly, they may become moved towards excellence or better quality at the cost of being poor friendly. And then the third generation have never been with the first generation, and they start thinking about themselves. Can we not pay ourselves more? Can we not have better quarters? And slowly the original mission has drifted away. So we need to put into place something that prevents that from happening. So that is Dr. Roshin, who has taken over from me. And now I am not holding any administrative post at the hospital here. And we are just standing by and helping the new team of leaders to take the right decisions. Many hospitals struggle for want of well-planned takeovers. You cannot just hope that someone will come along. You need to plan and prepare. And the closure of many hospitals can be linked to poor or absent succession. So are we doing what is needed? So let me close with these questions. What sort of person are you? Even if you are not a leader, even if you don't have a post, you are still a leader. Am I a title type of person or a towel type of person? What is my place in God's big plan? What exactly does He want me to do? If I take stock of my life today, where do I stand as an influencer of other people's lives? So whenever there is a relationship between two people, you can immediately know whether the other person is a good person or a bad person for you by how it has impacted your life. If you have become more godly, more passionate, more kind, then the other person is having a good influence on you. So let us examine and see how other people have changed because they have you in their life. Where do I lack? What do I lack? And what should I do to make myself a better person for God in the place where I have been placed? We need Christians everywhere. If you are called to be to government service, please take it. But we must know the cost. I always say cost versus benefit, risk versus benefit. There will be enormous pressures for you to compromise on your values. If you go to a government hospital and do all the bad things that go on there, then what is the point? If you go there, you must be such a different person that they will say that is because he is a Christian. If that is your calling, then please join government service. You will make a great transformation there. As far as corporates are concerned, there is one problem. Corporates run for profits. And in order to drive profits, they are willing to do practically anything, especially when there is a lot of competition. So again, risk versus benefit, cost versus benefit. If you still think I can be in a corporate, I will not compromise on any core value, Christian core value, then why not? Maybe you can help missions in some other way without actually working in it. So many times we think that my Christian life is based upon quiet time, and that is often told to everybody. So the problem is what happens. We get up early in the morning, we take our Bible, and then we spend about half an hour reading through that. So that is me being a Christian for the day. The rest of the time you do whatever you want, you're angry with everybody, forget about lots of things. And then in the night again, we have a short period of prayer. So I suggest that we exercise what I call as God consciousness throughout the day. From the waking moments till the time you go to sleep, God is with me. You actually don't really need to pray loudly. God is not listening to the words that come out of your mouth. He's listening to the thoughts in your head. He knows everything that you're thinking. So throughout the day, when I go to my ultrasound room, Lord, let me not make a mistake. Let me not miss a finding. When I go to the operation room, let me not cause any problem to any patient. Let them all become all right. When I meet a person who says, I have no money, let me take him to the place where he can get charity. When somebody comes and says, my mother died, I'm not very good at social thing, but I can tell my wife is there to talk to you. So throughout the day, and at the end of the day, I can say, this day was lived well. So I had several mentors, each one an expert in a particular area. For example, for many years, a senior mentor for me was Dr. Vinod Shah. He was the first person who motivated me when I went for the 1987 Pachalur camp. We must have exchanged hundreds of letters. I visited him for 2 months at the Christian hospital in Chinchpada, where he was the medical superintendent. And then after I joined EHA again, he was there to help with a lot of decisions. I think many times we may not have close mentors, especially when you are the only doctor or only two doctors in a lonely place. So we need, especially if you are married to a good spouse, we can be each other's mentors. So the number of mentors depends upon the opportunity. Today, it is not difficult to have many because we are in a very connected world. And our greatest mentor must be God. Many times in college fellowships, people say, what a wonderful, warm fellowship. And then they go to a hospital where they have no friends. And after 2 months, they said, what a cold place. Because when they left the college, they have not learned to depend upon God. They have started to depend upon their friends. So we need to learn to depend upon God for everything. I think urban missions will be a place of great need. If you look at the USA, maybe around 60 or 70 years ago, the greatest needs were in the countryside. But today, the greatest needs are in the inner cities, full of crime, full of poverty, full of all sorts of severe problems. That is where the neediest people live in the USA today. Many years from now, India will have the same situation. Right now, the needs are greatest in remote rural places. But we must keep track of, I think the theme of the conference is very nice. So we need to keep track of the times. And today, if you ask me, let us take Hyderabad city in India. One of the best healthcare systems is in place. Everything is free. The poorest man can get the best treatment. He can have a CT scan or MRI scan without any money. But then the neediest people are the people who have come to work from Bihar, from Jharkhand. They're doing construction work. They do not have a Andhra Pradesh or Telangana identity card. So who will look after them? The government is not going to. They're not our people. They're somebody else's people. So if I were to establish a mission hospital in Hyderabad, they will be my target people.